Hi, everybody. Good morning, good afternoon, and good evening to people all over the world. I, Dr. Kapil Dua, President of the International Society of Hair Restoration Surgery for the year 22-23, would like to welcome you all on the occasion of second annual Hair Transplant Repair Day. We at ISHRS have launched the Fight to Fight campaign to help the patients who are undergoing hair transplant surgery so that they can make up their mind and help us to, to make an informed choice. So International Society of Hair Restoration Surgery is a global non-profit medical association and the leading authority on hair loss treatment and restoration with more than 1,200 members throughout 70 countries worldwide. Above all, ISHRS is dedicated to achieving excellence in patient outcomes by promoting the highest standards of medical practice, medical ethics, and research in the medical hair restoration industry. Disclosures, this is a presentation just to raise awareness of what is happening today in the hair transplant surgery field. It is our intention to educate potential patients about the need to search for experienced and ethical doctors to perform their surgery. As I mentioned earlier, ISHS has launched the Fight the Fight campaign. It's an awareness campaign to educate patients on the hair transplant industry's best practices and warn of the clinics where doctors do not perform the surgery. Yes, you heard it right. Doctors do not perform the surgery, yet they market themselves as legitimate. And today is the second annual hair transplant repair day. So ISHS has designated November 11th every year where surgeons will be performing pro bono surgery for victims of incorrectly performed hair transplants done illegally by unlicensed technicians. And more information regarding the same can be found on hairrepairday.org. And the hashtag is Hair Transplant Repair Day. So to discuss more about that, I have a distinguished panel of doctors who will be talking upon beware of who will cut your scalp in a hair transplant surgery. This is an ISHRS patient educational live stream program today, and we have various panelists over here. I would like to welcome them all. We have Ricardo Mejia, who is the chairman of the of the Fight to Fight committee. Welcome, Ricardo.
Thank you, Kapil, and good morning, or good afternoon, or good evening.
And then we have the Vice President of ISHS, Dr. Brad Wolf from Cincinnati, Ohio. I welcome Brad. He has been instrumental and he will be taking care of the communication and public education campaigns of ISHS. And he's a member of the executive committee who is with whose initiative we are doing this program.
Good morning.
Along with him, morning, Brad. Along with him, we have Dr. Shady El-Maghrabi. He's from Egypt.
Hi, Kapil.
Good afternoon. Hi, Shady. Hi. Good afternoon to you. Somebody to say good afternoon.
Good afternoon.
So he's a board of governor with ISHRS, and he has been actively involved in the Fight to Fight campaign, and he keeps on seeing a lot of patients like the ones we are going to discuss now. And along with that, we also have the president of the Indian Association, that is the ISHRS India, Dr. Anil Garg. Good evening, Dr. Anil.
Good evening, namaskar. Thanks, Dr. Kapil and Dr. Bradley Wolf, Ricardo and Shady for inviting me for this an important discussion on hair repair day organized by ISHRS. Thank you.
Okay, so since we have all the panelists now over here, I would firstly request Ricardo, who is the chairman of this committee, to please outline that what is this Fight to Fight and what is this hair transplant repair day, if you can give me some idea about the same.
Sure. Well, the Fight to Fight campaign is something that's been going on for many years, really. And what the Fight to Fight campaign stands for is fraudulent, illicit global hair transplants. And what we have seen throughout the years, over many, many years, is many individuals that are not licensed, unlicensed, don't even have a medical license, that are doing surgeries on people and specifically cutting the scalp and doing these follicular unit excision procedures. So a couple years ago, the ISHRS launched this campaign as a public awareness to try to educate patients about some of the problems associated with this industry, unfortunately, and that is people that are doing surgeries illegally or fraudulently. We at the ISHRS get many complaints and emails from patients regarding, I went to this clinic, I didn't have a doctor, no doctor saw me, they did this procedure, and I didn't get the results I was expected, or I was left disfigured or scarred, and they're devastated by this. So this campaign, the Fight to Fight, was originated due to all the problems that we've been seeing around the world to help educate these patients on these problems.
Thank you. Thank you. So I would also like to have the opinion of Dr. Anil and Dr. Shetty. Do you people also see this kind of illegal work being done in your countries? Anil, please.
Yeah, we see a lot of patients like this who has been operated not by the doctors but by the technician. And along with the ISHRS, the Indian Association of Hair Restoration Surgery has started the campaign, and we gave the name of Ghost Surgery to it, along with Fight to Fight, in which the patient, when go to the consultation, he consult a doctor, he fix up surgery with him, but when he is being operated, he's operated by not by that surgeon to whom he or she consulted, but by the technicians. And unfortunately, we have the many group of technicians, and they openly advertise and they send the card or the call to the surgeon that you call us, you just pay us this much amount and we'll operate, you need not to do anything. We have been watching this very closely, and Indian Association has started this campaigning in 2019, and we gave the oath at that time to all our association members that they will be doing all absolutely ethical activities. And recently, we had seen few deaths, and on that the government took the cognizance, and it was in the court, and the National Medical Council has released guideline, which is a very, very serious and a great startup to awaken the peoples of the society. Even now, the news channels are coming up, newspapers are bloating the news that everyone should know that who is operating them. This problem is across the world, including the India, and we need to educate the people. And for that, this ISHRS has taken up the biggest step of Fight to Fight, and Indian Association has taken this step as a ghost hair transplant surgery.
Thank you, Anil. Yes, Shetty, how about you?
Hi, Kapil. Yeah, as you know, I'm working in Egypt, and I've seen a lot of cases in the Middle East. We have many black market clinics, and there's an important point I want to say. Not all the patients going to these black market clinics are patients who are looking for cheap surgeries. I have seen celebrities going and traveling to these clinics. They think that they are more professional. They can do like mega sessions, more number of grafts. They don't care about the money. Actually, the celebrities not looking to save like a couple of thousands of dollars, but he wants to have the best look. So they travel to these countries where clinics, like 90% of the clinics there are black market, but they don't know. And this is very important in our campaign, the education of the patients. Most of the patients that go there, they think that they will have better results than doing the clinics, than doing the surgeries in other clinics. in their countries with professional doctors. So the most benefit of our campaign, Fight the Fight.
Yeah, I think when you keep on seeing something, it starts occurring that is mainly like that's the truth, or that's what is being seen so much on the screen. So people start believing that. I move on to Bradley Wolf. Bradley, you are perhaps one of the senior most amongst us, and you would have seen the industry evolve over a period of time. So can you share how was your experience in US?
Yes, it's even in America. I'm in Cincinnati, Ohio. We see a form of the black market. It's not in large clinics run by unlicensed assistants or businessmen. It's some are qualified plastic surgeons who just buy a machine, and the owners of the machine company train the techs, and this qualified doctor will hire these techs. So it's on a smaller scale, but I see it in my city. There are 4 or 5 doctors doing this. And in the state, there are many. So it's really not, it's not in your countries, it's really all over to some extent. But it's, it can't be justified. Some clinics may justify, well, this is just in the medical codes, it doesn't say they can't do this, or it says we can't. Universally, it is not legal to delegate the practice of medicine. Making incision and surgery is the practice of medicine, and it cannot be delegated to an unlicensed person. So it is clearly illegal. You can call your local authorities if somebody's operating on you that is not a physician making incisions. I would call the police and have them come over, because it's a felony in the United States. It's a felony to the unlicensed practice of medicine, and the doctor is also responsible because he is aiding and abetting in the unlicensed practice of medicine. So it can't be justified on any level, and we're trying to fight it as hard as we can.
Yeah. So what I can gather from the panelists is that this problem has now spread all over the world, from South America to North America, covering the Europe, Middle East, and the Asia as well. So that's why the ISHRS is so much concerned about it and spending a lot of time and energy on educating the patients. The whole premise of this program is to educate the patients. And that is why the ISHRS is even having this hair transplant repair day. So Ricardo, can you highlight more about the concept of hair transplant repair day, and how did it come up, this thought of hair repair day, and like what all things were done on the first day? Can you just elaborate?
Sure. Well, this was an idea that was started by one of our members, Dr. Marcelo Pichan from Brazil, who, as we're discussing kind of how do we educate patients, how do we bring awareness, his idea was to provide a support system from our society to the public in an effort to unite all doctors from around the world on this day, November 11th, to repair free of charge surgeries from patients that have been botched or gotten some not so good results. And the idea was to really bring all the doctors around the world together to bring information to the public about what we can do to help and how you can get the proper information, what you should be asking in terms of, who's the right surgeon? Am I falling into the right hands? And that's the idea, was to bring the society together and all doctors around the world to come together as a unified voice to say, we're here to help. And if you have a problem that unfortunately perhaps you didn't research, or you were, duped by marketing or fraudulent ads, and unfortunately some of these clinics, as Dr. Wolf, Dr. Shady has and Dr. Garg, we see these clinics, posting great results, posting great photos, very fancy, but when they get there, it's not what they expected. The doctor's not even in the room. And one of the questions that was asked by one of the audiences, well, what can a patient do, if there's no doctor in the operating room? What can a patient do at that point? It's a very difficult problem when a patient goes to a clinic expecting to be operated by a surgeon, and then there's no doctor. How does the patient handle it?
I know it's very tough.
I have a comment on that.
Yes, Shady.
Yeah, I know a famous doctor. He gave the patient sedation, then he starts like 10 minutes, then he disappears while the patient is sedated. And when the patient wake up, he just can come back and give him another dose and go out of the room. So this is not honesty, and he's deceiving his patient because the actually like the technicians are doing more than 90% of the surgery, not the doctor.
Yeah, I have done today only a surgery of a patient whose donor area was all over harvested, and he had undergone one surgery 2 years back from another clinic, another well-known clinic. He has even put up the video testimonial, which we will put up in the resources. So he said that the doctor talked everything, and now once he went into the OT, he just made a couple of slits at the front, and then the doctor disappeared. The whole of the harvesting was done by the technicians, and you can see that his whole donor area is over harvested with this couple of grafts being taken out. So moving on, Dr. Bradley Wolf, how do you define a safe hair transplant surgery from the patient's perspective? How do we tell them that what is a safe hair transplant?
Well, you should look at your doctor's credentials and investigate the clinic before you go there, and trust that doctor to alter your appearance. I mean, what we're doing is going to alter your appearance forever, and we have a limited number of donor follicles. So really, it's like you're born with a certain amount of money. You can't invest it. You can't make any more. That's all you have, and actually it decreases as you get older. So it really needs to be kept and taken care of, and a doctor should have your best interest in mind. He should sit down. You should see a doctor, and the doctor should do the consultation, because there are contraindications to surgery. There are conditions that aren't male pattern hair loss, and the patient is not a candidate. They could have a dermatologic condition, or they may have very advanced hair loss and need medical treatment first. Many patients need medical treatment to stabilize the hair loss and before they do surgery. Not every person who goes for hair transplant surgery is a candidate. I turn many down. We have to look at it's almost like a fiduciary looks after your money. We're like a fiduciary for the hair. We have to take care of the hair for the whole patient's life. So you should get a feel of whether this is legitimate. Talk to the doctor. A lot of clinics, you go in and talk to a consultant, or you talk to a salesman. And this paradigm where you meet the doctor on the day of surgery, that went out about 20 years ago. I think it's important for you to check out and you do a consultation on the doctor to get a feel for who he is. Does he have the experience? Does he have the credentials? What does his office look like? Does he have before and after pictures? Are they his before and after pictures? We see in the Fight the Fight and these illegal clinics where they're using other doctors, established doctors' photos. So it takes some investigation. I know a lot of young young men who lose a lot of hair are the most psychologically devastated by hair loss. So they're the most gullible. Chances are they don't have as much money because they're younger, but they're affected more. So they're more likely to go to a cheaper place, one that has this great advertising, gives false promises, and charges less. So that's a typical patient that would go to these clinics. A lot of other patients would too, but you really have to do an evaluation of that doctor, because you're trusting him with your appearance. So it's very important.
Yeah. So Shady, would you like to add some more points? Because if you look at a patient's perspective, when he Googles hair transplant, he finds thousands of people up over there. And you and me know that the people put up the pictures of each other, like they keep, the steal from one, and we can identify, but look into the patient's world. They are innocent people. They don't know. So what will be your advice to the people who are looking for hair transplant? Like how to identify the right doctor? That's the biggest job.
Yeah. Looking for a safe hair transplant, you should first thing you should search for a doctor with credentials where this doctor was trained, and what's his experience, and he can search for to see if this experience and training were real or in like in fake places, or he has been trained in the black market, and does this doctor has license in the country where he practice, and then he should uh, ask the direct questions to the clinic: who will perform the surgery, what are the steps that the doctor is doing, and what are the steps that the assistants are doing, and what are the training of the assistants. There is very important thing that people don't ask: if this team is trained on management of emergencies is very rare in hair restoration, but it might happen. So this clinic and this team should be well trained on management of the emergencies as well as the complications that might happen. So I think these points are might be enough to choose a good clinic and a good doctor.
Along with this, Ricardo,
Yeah.
I would just like to add that sometimes when I tell my patients, if any doctor is saying yes to everything that you say, it means that you are not in the right place. Like a doctor should have a judicious plan, as Bradley was highlighting. So if I get a lot of patients who say 5,000, 6,000 grafts in one day and cover the whole scalp. So I tell them that the moment somebody says that, that's a no-brainer, that this is not going to happen. No doctor is going to do it in one day, this much surgery, and without any side effect.
Yeah,
You can get in a lifetime over 2-3 sessions.
might-
That's a separate thing. Yes.
I might add, Kapil, that you might also ask, how many surgeries do you do in one day?
Yeah,
it's
that's
very,
another thing.
it's very, I only do one surgery a day. I know some people do more, maybe 2, maybe 3, and that's manageable. But when you start getting to 5 to 10 to 15 cases in one day, you got to realize that you're just a number, and the doctor is not going to be present. And I think that's an important question. And I know Dr. Garg does a lot of education, and I think maybe he can comment about how important education is and attending meetings is for doctors.
Yeah.
Yes, Dr. Garg.
Tell my patient how to confirm that who is going to operate. So I have put a checklist format, and the patient should make that checklist. Now, how to select a doctor? First point is he should see the qualification. That qualification, even he can confirm. Like many times the patient come to me, I have written ISHRS, then they go on the site of the ISHRS and they confirm that their name is or not there. So he should see the qualification and he should see the association with which he is attached, and then he can go on the website of the association whether his name is there or not. Second point is expertise and the experience, that his website testimonial, quality of testimonial can very well inform that these testimonials are fake or real. Many times the patients, his own, while operating, just after surgery, just after, they can give the testimonial, and 2-3 testimonial he should listen. If he see that the wordings are the same or similar, then he can identify even these are fake or not. Even Google has got the software which, by use of the artificial intelligence, they can identify, because many times the patient comes to me, they are from the Google or from software, they tell me that, doctor, we have put your website, your testimonial on Google artificial intelligence to confirm that the testimonial which you have put, they are correct or not. So confirmation of the qualification, confirmation of the association to which he is attached, then the confirmation and to know the testimonials. These are the 3 things. If a patient rightfully do, he can 90% confirm that the doctor to whom he is going to consult is a genuine doctor. Then he can, when he travel to his office, that as Dr. Bradley Wolf told, that the atmosphere of the clinic or the center tells many story many times whether this doctor is fake or the right. Then the question, he should have a questionnaire in which he will ask each and everything. Like many times I tell my patient, you ask me first questions, what are my qualification, from where I got educated. If the patient makes 4 or 5 points of that, I'm sure that patient can really come to know that this doctor is fake or not. Then he should ask the plan, as Dr. Kapil has said, that if whatever the patient is asking and doctor is telling yes, 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 it can be done, I'll do the way you want, I'll perfectly make like this, I'll do the best. I think these are the few words which will create the doubt in his mind. He know these things are not possible. Then he should also see the operating room as well, where he's going to operate. He should ask him what are the emergency measures do they have. So these are the few questionnaires which we can highlight even on our website, like I have put on my website. Before consulting, this is the checklist. Then I also believe that one patient should consult at least two doctors. This may be look slightly odd. I tell my patient, when you are going to buy a TV or a mobile phone, you at least travel two shops, and those things you can return them back. But if you are getting your salary done, so at least consult two doctors. By consulting two doctors and comparing their wordings, comparing their plan, you can come to know whether this says what the doctor is fake or not. Lastly, as the Shady has also told, that the patient should ask to the doctor what you are going to do, what you are not going to do. Number one. Number two, as Shady said,
Sure.
patient is under anesthesia, doctor disappears. Then he again comes. At that condition, patient may ask to the doctor, dear doctor, we have come to know many times the doctor disappear. I have a doubt in my mind. Can you confirm me how I'll come to know that you have operated or not? Because many times patient ask me how I will come to know how many grafts I am going to put. So it's not bad if a patient asks to the doctor, I have a doubt in my mind, please don't mind. Are you going to win the OT and how I'm going to confirm it? See, these are few leading questions.
Yeah, we will get to more detail about this. Yes, Ricardo, you had a point to make.
Well, I just wanted to clarify. I wanted to clarify something for the public that Dr. Garg said. He mentioned ISHRS, and maybe some people don't know, but that stands for the American Board of Hair Restoration Surgery, which is a separate organization that ensures that doctors have the proper knowledge, education, and training regarding hair restoration, and there is a separate certification process and board for this society. And so I just wanted to clarify what the ISHRS was.
Yeah, along with that, if any doctor tells you 100% success, that is again a no-brainer. All the people of
and I think to Shady's
would
point,
agree with me that
yeah, and I think to Shady's point, in fishing tournaments, they have an observer on a boat to ensure that people are honest about what they do and they catch the fish correctly in these big tournaments. And I think you can ask, can I have an observer in the room to watch? And if a doctor says absolutely no, maybe that could be a red flag. We do allow people to observe, to watch. So if there's a family member that wants to be present and to watch every now and then, they can.
Yeah, it's a good.
I have another. Okay, I have another comment to add about choosing the doctor. Like many patients they like the doctors that appear a lot on social media. Like there are some doctors, we call them social media doctors. He does like 3 or 4 live videos every day where he performing surgeries on different patients and during consultations. Actually, this kind of doctor, he only go live when he works. So like you see him working 5 minutes. This is the time when he take videos and post them live. I do only one surgery per day. I cannot do a live video every day. Like the surgery is very long. We the time is very tight time. We are tired. Just have some breaks. It's not easy to do like 2-3 videos every day. So this is also a red flag on choosing the doctor.
Yes. And many people do get confused with this, and they give more preference to the advertisement than the credentials of the doctor. So moving forward, Dr. Anil, what do you think are the main risks associated with the hair transplant surgery?
Yeah, thanks, Kapil. The main risk are the two type of the risk. One is the technical failure, and second thing is the life-threatening or a complication, medical complication, surgical and medical. Surgical complication may be if the doctor is not trained, he is not operating, then the failure of the hair transplant means the poor growth, there can be no growth. The anesthetic result, there can be less growth, and there can be a wrong design of the entry hairline. So this is the basically technique related complication if the surgeon is not trained. But about this, then if he is not experienced and he is doing over harvesting, means the donor area complication he can have, means he can accept more number of graft, he can do more transaction, he can spoil the donor area, as we are seeing the lot of pictures.
So
And
if we can move on to the medical part first.
then the medical complication are much more serious, in which there can be infection if he is not using proper sterilization technique, if he has not investigated a patient before surgery and first consultation, right at the second moment he put the patient, then if patient is having diabetes or other disease, then he can have the infection. Heavy smoker, if he has operated, then the failure, the necrosis of the skin, and many times these complications may be life threatening. Like doctors recently, I've seen the Mauro Spangeni has told there were the 3 deaths in Brazil. Similarly, 3 deaths were in India because of the infection and because of the shock or some other reason. So, from failure of the hair transplant to the loss of the life, the complication can take place in any of this range. So, one should be very
So
careful
if
to select the doctor.
so if we have to like broadly classify, do you agree that infection is going to be one of the most important complication which can occur, which we have seen in India? And apart from that, allergy to the anesthetic drugs can be another one, which as a patient you should be careful about. And number 3, if you have any pre-existing condition like diabetes mellitus, hypertension, if you are on beta blockers, or if you are on some other medication, you must tell your doctor everything so that they can go more and guide you. Like some people are on antiplatelet medicines which allow increase the clotting time of the blood. So you need to be careful about all those. And Ricardo, I think you want to add something more to that.
Well, I think there was, in the comments section, there's some comments about how people have actually died in hair transplantation surgery. And we got to remember that this is a serious medical procedure. It's a long procedure, a lot of anesthesia. You mentioned all the medical complications. People may have, heart problems, diabetes, on beta blockers. And you want to be in the hands of a physician should a complication arise.
Yeah, so as a patient, you must understand it's not like going to a salon. Like you're going for a haircut, you'll be there for half an hour. It's not like that. You have to be, we as doctors have to inject medicines, mainly the anesthesia. We work mainly under local anesthesia, but all kinds of problems can occur. Like any other medicine, there's a toxicity of this medicine as well, which can manifest. Yes, Shady, you want to elaborate more on that?
Yeah. Actually, also, I mentioned before, the team, the technicians are not trained to deal with the emergencies. This is a very, very important point. Like if you go to a professional clinic or a hospital, the doctor and the team will be trained for basic life support or advanced life support. This is not the case when you go to black market. Also, I want to add that the risk of complications during the surgeries in the black market, the most common complication that I see in all patients coming from black market is the depleted donor. Actually, this is a very, very bad complication because we cannot, even in many patients, we cannot do repair surgeries. So if you go to black market, you have bad result. When you go to another doctor, you cannot, because they finished all your donor, they depleted everything. So there is no future surgeries can be done to repair the case. And also, the last thing I want to talk about, the scalp necrosis. In the past, before the black market spread, we used to see this necrosis very low rate, very low rate. But now, like every month, I see patients coming or sending me photos with scalp necrosis. They inject epinephrine, very high concentration. They do aggressive and deep incisions with high density. So they are cutting all the blood vessels from the scalp, causing necrosis, which causes permanent scarring, and the treatment is not easy.
So can I have the slides up to show the people what the panelists are saying regarding over harvesting? Can I have the slides, please? So if you can see, this is aggressive over harvesting, 4,500 grafts being harvested in a single session, which Shady just mentioned. It leads to a permanently disfigured donor area. These kind of things can happen, and no hairstyle can cover this. So again, you can see that the whole donor area is looking thinned out and the moth eaten, and you can hardly do anything about that. And this is perhaps irreversible. Many people, you can even ask this question to your doctor, that if the grafts are taken out, like, do they grow back? Some people even say that they do grow back, but unfortunately, once you take out the graft with root, the graft will never grow back in the donor area. So you should be careful about that. Again, poor growth can occur, infection can occur, necrosis can occur. So all these things can occur, leading to complications. And in fact, the patients feel even more bad when they feel that the procedure has not been done in the right way. And as you can see over here, improper direction and unnatural spacing of the graft. So this is another case of mal or wrongly treated eyebrows. So yes, going more on to that, Dr. Wolf, I would like to have your opinion that we know hair transplant is not a procedure, it's a surgery. So what steps of the surgery? Still, we do take the help of technicians. Some people take the help of technicians. So can you elaborate, as per the legal or the ethical standards, what steps of the surgery should be done by the doctor? And if somebody is taking the help of the support team, what is legally allowed?
Well, and it differs in different jurisdictions, but again, jurisdictions. But the basics are that you can't make an incision if you're not a licensed medical professional. So the surgeon must make the incisions. But going back to what we were talking about, that this is a serious medical procedure. In its details, it may not seem like it, but it is. A patient needs to be evaluated by a doctor or someone who is licensed to see if they have pre-existing conditions. These conditions can affect the result. If someone is on an anti-inflammatory and they're bleeding and that's not picked up and you do the surgery, it can cause the result to be less. So everything should be geared towards the best results. And keep in mind, this is cosmetic surgery. So if someone has a problem, they're not feeling good, they had a prior procedure a few days ago, or they're on some medication, the surgery should be canceled. There should be no question. This The other things are high priority. A cosmetic surgery isn't of the highest priority. It could be done at a different time, and it should be done under maximal and optimal conditions at all times. I refuse patients because they have some other medical problems, and those have been some of the most loyal patients. They've come back when when the medical condition is appropriate. So it is a cosmetic procedure, and the doctor needs to make the incisions. That's the bottom line. So in addition to the evaluation, in the donor area, a punch, even if it's a 0.8 millimeter punch, that is a circular incision, and it takes experience and judgment to take these grafts out. Know how many to take out, what density to take out, what to leave behind, what is the patient's, what does it look like, their propensity to more hair loss. So the doctor needs to take out the grafts and evaluate how many need to be taken out and choose the number. And they should make the incisions in the scalp in the recipient area. If you're using sharpened planters, an incision is involved, so that needs to be done by the physician. An assistant can, after a graft has been scored in the donor area, an unlicensed person can pluck that out. After an incision has been made, an unlicensed assistant can put a graft in, whether it's with an implanter or with forceps. So the evaluation should be done by the physician. All the incisions should be done by the physician. And the legalities, like I said before, differ from place to place, but it's nowhere on the planet is legal for an unlicensed person to perform surgery.
Yeah, I certainly agree.
Yeah, if wherever the judgment is required, it should be done by the doctor, either in diagnosis, either in designing of the area, which is called as slick making, or taking out the strip, or maybe harvesting the FUE grafts. Yes, Dr. Garg, you would like to add something more?
Yeah, just to support what the question you asked to Dr. Bradley. In our clinic, we have this sort of a consent form in which we have clearly mentioned that what the doctor is going to do and what the assistant is going to do. So this further adds to the transparency to the patient, and patient knows very well inside the OT, and also doctor feel that what he's got the sign, he should do that. I think this is a double check, and we have put it for the legal point of view also. Many times the patient think that the entire surgery will be done by the doctor, because extraction, everything goes fast and implantation is taking the time. So sometimes it can be reversed. The honest doctor doing everything what has been, but sometimes patient thinks that implantation, everything will be done by the doctor. So in that case, such things doubly protect the doctor as well as the patient both.
Thank you. So I would like to know more from the panel that what steps are being taken by your government to ensure a safe surgery. This is very important from the patient perspective. And what can the patients do if they feel that the surgery has not been done in the right way? So I open it up to the panel, and I think I would like to have the opinion of everybody. Everybody is from a different state. So we start off with you, Ricardo.
Well, in Florida, the Florida Board of Medicine actually reviewed this, and they have actually ruled that it is illegal for a unlicensed person or a person who is not doesn't have what we call the scope of practice to do surgery, because this is cutting the skin and doing surgery. And a person who does not have that license or authority, even under a doctor's supervision, even if a doctor's sitting there and saying, okay, go ahead and do it and I'll watch you, it's illegal and inappropriate for a physician to delegate surgery to an unlicensed medical professional. And even if that person is a licensed medical assistant in Florida, that licensed medical assistant does not have the scope of practice to do surgery. It's kind of like saying, my plastic surgeon is going to tell his medical assistant to do my wife's facelift. You just don't do that. You don't delegate surgery to another individual. It should be the doctor who has hopefully the most training and support. So in Florida, it's certainly illegal, even under direct supervision. And I'll comment about the Dominican Republic. The government has actually been closing down clinics because a lot of doctors are coming in from out of state and performing surgeries that don't even have a license. So the Dermatology Society and the hair transplant doctors are bringing this awareness for patient safety to the government, and the government is stepping in because it's really illegal.
Thank you. Yes, Dr. Bradley Wolf.
Yes.
What about you? We move on a circular now.
You would think, how could this have gone all over the globe if it's illegal? Well, that is a problem. That's the problem we're fighting. It's all, in some aspects, it looks like the perfect crime because patients don't know, other doctors don't know, and medical boards don't go. No, I have a colleague who knows the president of the medical board, state medical board, and he presented this to the president, and the president was clueless. He said, "Well, just have your attorney call." And he said, "We know illegal things are being done." And the president said, "Well, if there's a violation of delegation, it has to be reported." So a medical board based on a doctor's complaint without evidence can't go investigate. There has to be evidence. And the medical boards are so busy with doctors getting DUIs and prescribing narcotics. They have a stack of papers every day with documented evidence that something was done wrong. So they need documented evidence to prove something was done wrong. And it's not me complaining. It would have to be a patient who complains. And I've been told that's the way to make inroads, is have a patient complain to the medical board, or I think you go to the local authorities if a felony is being committed, which it is. In my state, there was a precedent case that determined that the making the incision is the practice of medicine. And so you have to be licensed. But we have a lot of work to do because it just falls through the cracks. Authorities don't understand what hair transplant is. They don't understand the delegation part, the mechanics of it. And it's going to take education of the patient, education of the medical boards, and reporting of the violations. And it's going to be a long, hard road. But that's, I think, the only way we can make some inroads.
So this is for the patients. It's not about one doctor speaking against or reporting another doctor. Right. So patient has more value. Your complaint is going to get more weightage than what we all say. And this whole session has also been in empowering our patients so that you should know what is right and what is your right to do when the things are not right. Yes, Shady.
Yeah, I want to go back to the original topic about which steps should be done by the doctor. Actually, as Brad said, the consultation. This is a very important step where the doctor can check both the donor and the recipient areas and put the plan and the surgical plan and the future plans. How many grafts I need in this surgery? How many grafts will I need in the future? How will my hair loss advance in the future? And what will I need in medical treatment? All these details. Actually, in the black market clinics, this step is usually done by a salesman on WhatsApp. You send your photos, you reply, okay, we will transplant 5,000 grafts, and you go and they transplant most probably a big area, and they can destroy some of your good hair follicles that you have right now. And the problem also, as I mentioned before, they can deplete the donor area or over harvest. So the future surgeries, you need more grafts in other areas. You will not have this number of grafts. So the consultation and the examination is very, very important step. Cannot be done by an assistant even. It be done by the main physician who will perform the surgery. Also, the anesthesia and the tumescent solution injection. In my office, I inject the anesthesia and the tumescence by myself, even if it is done by other assistants. This should be done under observation of the doctor to see if there is allergic reaction or any cardiac manifestations, or if anything wrong happened, you can stop and manage not leave just the technicians. I like doctors open like 20 or 30 operating at the same time. They are all giving the anesthesia at the same time. You cannot even, if you have this number, you cannot even observe the surgeries. Like if you have 4 surgeries, you cannot observe the surgeries. If one patient has a problem and you will stand next to him, you will not see the other patients. So this also is very important, and also the extraction, the scoring at the recipient sites. The incision, the skin incision. Patients should not let any non-doctor to cut his skin or his scalp. This should only be done or must be done by the main physician that made the consultation and know everything about the case. And even the other steps like the implantation that could be done by the assistants, the main doctor should be observing them most of the time. Some cases we have very hard implantation and very hard insertion of the grafts and popping up of the grafts and bleeding. So the doctor should be there so he can manage the situation. He can see if the technicians or his assistants doing the implantation in good technique or not. Uh, in my opinion, implantation is one of the most important steps, and if it is done wrong, the patient will have very poor growth. Many cases with hard implantation, crushing of the grafts is very common, and when after all the grafts are implanted,
Dr. Shetty.
yeah.
Yes. Shetty, what steps are being taken by your government? Is the Egyptian government even sensitized towards the hip transplant surgery, or it's like nobody's bothered?
Yeah,
how's it in your country?
It happened in few cases when patients complained, patients with complications, they complained, and a clinic was closed. This clinic was operated by Turkish technicians with no license, and there was no doctor inside the clinic. And the government, they went there, they didn't find doctor, only Turkish technicians, and this clinic was closed. But actually, they opened in another area. And they are still operating till now. But if all
so the government
if all patients report these kinds of clinics, they will not be there. They will be closed.
So the patient has to do that. Yes, Ricardo.
And I want to, basically Shady and Dr. Wolf Bradley said the most important thing. And if you're a patient out there that has had a procedure that you weren't happy with and you didn't have a doctor operating, patients need to complain and patients need to report this. Governments typically do not pay attention to doctors, okay? And they won't. They will only take action when there's a patient concern or a patient involvement. If, as Dr. Wolf says, if doctors complain, governments don't really do much. But when a patient is involved, when a patient is harmed, then they will act. And I think it's important for the public to know that, if you see something illegal or if you've had an incident that you're concerned with or upset about, then you have a responsibility to inform the government or the local authorities.
So Dr. Garg, can you just highlight that what is the experience of the patient when he comes to know about this thing? And there was always also a question mentioned for you that there have been some deaths mentioned. So can you elaborate more about that? And how can the patient, save himself? And what is the government doing about this? We have just 5 minutes left.
It's a very good thing. I would like to inform you that the National Medical India has taken a very great step to stop the unethical activity in the field of hair restoration, because few deaths has been noted and the question was raised in the parliament. Our National Medical Council has released a very strict, clear-cut guideline. I would like to, in short, elaborate who can operate a registered medical practitioner who's qualified, registered with experience in the hair transplant or the surgical background can do the hair transplant. Number one. Number two, guideline for the center. The center should have all the basic facilities, operating facilities, anesthesia facilities, sterilization facilities, emergency taking facilities. Then guideline for the assistant should be from a nurse or a registered who has done the training in either operating room or a nursing course. Then guideline for the anesthetist, if patient has a risk or surgeon feels it is advisable, preferable to have an anesthetist. Then hair transplant should be operated in a hospital setup where ICU is there. If not, then the center should have a direct attachment to a hospital where in case of emergency the patient can be referred. So these are the so clear-cut guideline has been released by National Medical Council. Now the question is, if something goes wrong, where the patient should go. They have released again the guideline. If doctor is doing wrong thing, then they can complain to National Medical Council. But if the patient has been operated by non-doctor, by a technician who is not trained, then this comes under the category of criminal offense and they can directly go to the court and they can file complaint to the police, or they are the local health authorities where they can complain. So such a clear guideline has been released by Indian National Medical Council and it is very helpful. Now, as Dr. Kapil has said, we had few mortality in the country and those cases were reported to the government. They are in the under the prejudice of the court, and certainly very commonly we have seen that many times or rather often the court take very serious take give serious judgment and often release some penalty to the doctor. So if a patient has got anything wrong with him, he can directly complain in the court, even he may not go to the police. So these are the few things which has happened, and unfortunately, and but our patients are going in the court and they are going to the government, going to the parliament. So the awareness has become very nice. Recently, because of this all National Medical Council, our the media is coming up. Just 2 3 days back, our national news channel has given 15 minutes of news for the awareness of the population, that how to select a doctor, where they should go. So these things are going quite actively in the India also, from government, from media side, and from our association side.
Yeah, nice to know that. So basically, the patient has to understand that if he finds that some felony has been done, he or she can approach the local medical authorities like the district health officer, or maybe approach the medical board to let them know about their status, and share whatever has gone wrong with them. They can even share their stories on ISHRS platforms. We have the Fight the Fight campaign, and I will be shortly sharing the resources about that. So I would also like to know from all of you that what is the experience of the patient once he feels he's cheated. So can somebody highlight that, because that I've seen it's very miserable. Like the patient, I was operating yesterday and today, like I operated, he was very upset. He said that I was never informed that the doctor is not going to take out the grafts. He he was, it was not only a financial loss but a lot of emotional stress. It had happened. One of my patients, like he went into a severe depression. He had undergone two surgeries from the same doctor. Both the times technicians took out 5,000 grafts each, and his whole head was empty. This was around 7 8 years back. So even if I called him for taking out some graft from the body, he said he's so depressed that he doesn't even want to come out. So I would like to hear more from all of you, that do your patients also feel something like that, or Please share your experiences. This who would like to share?
Yeah, there are the two things in this, Dr. Kapil. Patients feel cheated, and you rightly said they are emotionally disturbed. We all have seen such patients. Unfortunate part, why what I noticed that even despite promote them, they don't want to go for the complaint. This psychology I never understood. Patient has been cheated, looted, screwed up, and we tell them that this things has gone wrong with you. Even then, unfortunately, they are not going to complain. That's the unfortunate part I have been noticing in many of the patients. But of course, if casualty takes place, some patient dies, then it becomes a news and then he goes to the court. But if he has been spoiled, he doesn't go to complain. That's a unfortunate aspect which I have noticed in my practice.
Yeah, yeah, I've noticed that patients who are damaged in that way they just kind of want to brush it on, put it under the rug. They don't want to go to the medical board. They don't want anybody to know. They just kind of want to hide, wear a hat. So that's one of the problems we face in exposing this is these patients are emotionally disturbed, and most of them are men, and men, you know how men are. They just want to close off. They don't want to show people that they made a mistake. It's against their nature. They don't want to report to the medical board. I will say that when you do report to a medical board, it's anonymous. I mean, they don't tell the doctor. They don't tell who you are reporting, who reported them. So it's a paradox that you would think these people would be running to tell everybody how they were damaged and to try to get some retribution, but most of them just want to hide and don't want it to be public. And I think we should try to urge these people gently, because they are damaged, to try to expose this problem.
So it's not that difficult to do that, but very few people come forward to expose that. So Shady and Ricardo, any comments? What from
Yeah,
the public, or what do the people want to know? Okay, Shady, you have.
yeah. I have regarding the psychological trauma. I have seen patients who don't take off their hat even in front of his wife. He doesn't look even in the mirror without his hat. Now he sleeps next to his wife wearing his hat. This is very traumatizing. And actually, when we do the repair surgeries and he looks good, he gain his confidence back and he gains his life back.
Very sad to know that. Yes, Ricardo.
I think we got obviously the devastating patients, but then I think there are patients that, when they go to a doctor and they have a consultation, and they come to me and they've been to other places, I ask, okay, well, why here? Why some other place? And they've quite frankly say, well, I want a doctor to do the surgery, and even at some other clinics, a doctor might even tell the patient, look, I'm going to have my assistants do the surgery, even though it's not kosher, it's not legal or ethical. The doctors will actually tell the patients, they do it better than I do, and you got to wonder, if the doctor can't even do the surgery, then, what are you getting into? And a lot of patients kind of come to my practice. It's because, I'm the one doing the surgery. And fortunately, I have had some that, just decide not to be cheated, even though they've been informed, and they would just prefer having the doctor do the surgery.
So absolutely right. One of the comments that we have is that there are some companies advertising unlimited graft for a low price. So can somebody comment about that? That is it actually you can have unlimited grafts?
What do you see back here? There's a limit. There's a limit in the back of my head.
You have a good donor.
That's
You have
almost
unlimited donor.
Yes, and I think you showed a picture before of what the limitations are. I don't know if you can put that picture back up of the over-harvested donor area, but there's no such thing as unlimited, grafts. There is always a limit.
Yeah.
So this
Yeah.
is the pic.
Yeah, there's always a limit, and unfortunately, when doctors or patients want to get like the maximum done, this is unfortunately what could potentially happen in the wrong hands.
Yeah,
I know.
A lot of the problem is motivated by money. There are lay people out there that can make a lot of money doing this, and the hair transplant industry is a $4 billion a year industry worldwide. And some in the donor area can look like a cash register. If they're charging by the graft, the more grafts they get out, the more they can charge, even if they don't get that many. So it pays to go to someone who's ethical, someone who has credentials, being an ISHRS member, being an ISHRS fellow, being an ISHRS board certified. Those are all credentials you would look for. It's not perfect, but at least patients have the credentials. The state offers certain protections to patients, and the medical board, what really bothers them is somebody is damaged. And if you go to have neurosurgery, you can't, it has to be done in a hospital by a board certified neurosurgeon, or you can't have surgery. You can't have it as an outpatient. That's a level of protection. Having a medical license is a level of protection. But in hair transplant, a pediatric radiologist can go out and start doing transplants tomorrow. They don't have to have any additional credentials. So that level of protection is really not afforded. It falls through the cracks. So for the patients, you really have to do your due diligence to go on the internet. There's so many avenues available to do research, but more and more as we evolve, you have to really, and in medicine these days, you have to look out for yourself. You have to do your own investigation, because in this particular specialty, unfortunately, you're not afforded the protections that other people are.
Yes, thank you. Thank you
I
so
will say,
much. If anybody has,
I just want to say, based on what
yes,
Brad
Ricardo.
what Dr. Wolf was saying about education, on the ISHRS website, when you look up a member, you can actually see, how many meetings they have attended, and I think that goes to show that a person is really interested in making sure that they've got the art, the skill, and they're on top of this field and specialty. So I would advise you, as Dr. Wolf was saying, is go look the members up and see how many meetings have they attended. Do they go to any?
Yeah, so the credentials of the doctor and the whole operating team, the operating unit, is important to be kept in mind. It's not only the advertisement which has to be kept in mind, but like who is going to do the surgery. The consultation should be done by the doctor. The plan should be made by the doctor, because there are so many conditions where you can, which are happening on the skin, which can affect the result. So the diagnosis should be made by the doctor. The local anesthesia should be done by the doctor. Then the harvesting and slick making, at least in India, has been documented in the National Medical Council document, should be done by the doctor. And implantation can be done by the technician under the supervision of the doctors. Along with that, you need some more OT, or the operating theater people, to make sure that the patient gets a safe hair transplant surgery. So I would like to thank all the panelists for coming out, for giving their valuable time, and they have been very engaged, and I hope it's an equally learning session for all of you. And I would like to have the slides to show that where you can go to the ISHRS documents. We have put up some resources for all of you where you can go. So it's a Fight to Fight campaign, and you can go on the fight2fight.ishrs.org/patient case studies. So you can find more case studies on the website. You can find more experience of the people who have felt like you, like this. And the take-home message is that the hair transplant is a surgical procedure, and it should be done by the doctor only. So looking forward to more and more interactive sessions from all of you, and getting the feedback. Your feedback is going to be very important. And as I highlighted earlier also, these sessions are meant only for patient education. Hope that this initiative of ISHRS helps to make hair transplant surgery for you a better and a safer surgical procedure. Thank you to all the people who have joined us on YouTube, Facebook, LinkedIn, and all other places. Thank you very much. We will be coming next month again with another topic to deal with more detail. And we will be having a monthly webinar like this in different languages, in Portuguese, Spanish, German, whatever our patients will be asking us for. We have people from all over the world. There are more than 1,200 members and 70 countries. So whatever you want, dear patients, we will be there with you for all the information. Thank you very much. Thank you all the
Thank you.
Thank you, Dr. Dua.
Thank you.
Thank you.
Thank you.